Next, we're welcoming PICC's Community Advisory Board, or CAB, to present on reproductive health and COVID-19 through a health equity lens. PICC's CAB is grounded in the belief that everyone brings expertise to contraceptive care and that diverse expertise is required for PICC to succeed. The CAB is composed of 20 consumers of contraceptive care and community stakeholders throughout the state, and today we have two CAB members presenting, Chantel Bethea and Angelique Bouthout. Chantel has 4 children. Chantel is a huge advocate for education and access. She's been involved in the community of Worcester for 12 years. Her reason for wanting to be a part of the community is simple: her children. She wants her children to have more opportunities than she did and not have to jump through the hoops that their mother had to. Chantel is a true warrior and fighter who holds back nothing. She always speaks her mind through the lens of love. Chantel's been a member of PICC's CAB since 2019. Angelique recently completed her Master's of Education in Community Engagement from Merrimack College, where her capstone project, Self-Advocacy in the Exam Room, Tips and Techniques for Contraceptive Care, positioned access to person-centered contraceptive care as the social justice issue we know it to be. Her work encompasses community outreach, health promotion, social justice education, and customer service and engagement. Her favorite topics include sexual health, pleasure, communication, queerness, relationships, and access to care. She's also been a member of PICC's CAB since 2019 and has previously worked at Planned Parenthood League of Massachusetts, Merrimack College, and the Office of Wellness Education at Framingham State University. So welcome, Chantel and Angelique.
Hi, everybody. How are you? Give me a thumbs up if you're still with us. Good.
I'll move you along, Chantel. Thanks for working with me.
I gotcha. So we have our little presentation, but we want this to be a lot more interactive than anything because we want to hear from, speak to, use your chat functions and things like that. So we're going to talk about COVID through a health equity lens and reproductive care. So COVID drew, what we want to highlight here is the health inequities, disparities. They've become a bigger part of the public conversation over the last year and a half than they have ever before, for those that didn't realize that they were a thing. It consists a consistent reporting material. People in and out of medicine are talking about it, and it gained some momentum. Some other specific events also happened that are relevant for this conversation, which we'll talk about in more detail. And people are still being affected between long COVID, the further study of possible menstrual health side effects to the vaccines and new variants and rising cases. Mental health support providers in this for the long haul. And I hope we all are. I think it's just not going anywhere for a little while.
Definitely, Chantel. It's not going anywhere, unfortunately. So we just want to sort of set the stage a little bit with some information about sort of the current rates and trends, and specifically focusing on some of the inequities right here in Massachusetts. So while we experienced lower incidence and morbidity rates than many other states and countries, we are still very much in a pandemic, as you all know, as healthcare providers. But our research kind of provided some really interesting context for some specific inequities. So a study published earlier this year analyzed socioeconomic and demographic characteristics of patients tested for COVID-19 at 14 sites within the Mass General Brigham system. And this included, it was almost 4.6% of white patients tested positive, where 17.2% of Hispanic patients and 11.9% of Black patients tested positive. Medicaid patients had twice as many positives as those with commercial insurance. Patients in lower income areas were 3 times more likely to test positive than those in higher income areas. And people who lived in higher unemployment areas were nearly twice as likely to have COVID than those with low unemployment. As someone who has also worked my fair share in the service industry, patients from neighborhoods that had many service sector employees, meaning they couldn't work from home, they couldn't socially distance, they were also more than 3 times as likely to contract COVID-19 than others from communities with relatively fewer service sector employees. So this study really points to some of the structural factors that persevere in our society and contribute to health outcomes and specifically inequities. And data from the larger Massachusetts state dashboard really aligned similarly. And one of the data points that really stuck out to me that I wanted to highlight, whereas Hispanic residents account for 12.3% of Massachusetts residents, they account for over 37% of the COVID positive rates here in Massachusetts. So that is just a really stunning disparity to me. And I also have highlighted on this slide here the most recent reports for vaccination rates. So this came out as of August 31st, or the most recent before I had to get out my slides into PICCK. You can see that our overall state vaccination rate, so folks who have one dose of the vaccine, is 72%. But in that bottom row, there's a demographic breakdown by race. And you can see that it varies dramatically by race. And we can specifically point out that Indigenous folks over on the left-hand side, Black folks and Hispanic folks have significantly lower vaccination rates. And when we put those things together, right, we can see that there are structural factors that impact COVID incidence and also impact vaccination rates. And as healthcare delivery has sort of been transformed to reduce transmission, we know that there's been really exciting things that have happened for healthcare delivery. And there's also been some really big challenges, some shifting and confusing infrastructure. And that's what we're going to spend most of our time talking about today. So thanks. That was the data heavy slide. So we can all take a deep breath. We can move on. I would love if folks could put into either the chat or reactions on the bottom right hand of their screen, an emoji reaction, if this framework looks familiar to you, if you've seen this before. So this graphic is from a 2019 article by Holt, Reed, Creer-Perry, Scott, Wolf, and Dellendorf. And Dr. Kelsey Holt actually presented on this framework for PICCK earlier this spring. The webinar is still on the website. I highly recommend that you go and check it out. It's a really great webinar. But we're going to use this framework as scaffolding to discuss some of the ways that COVID and changes in care delivery have impacted the patient experience and health equity. Thanks so much for some folks putting this into the chat that they have seen this or they haven't seen this. So this is an exciting moment. I hope that this is also a jumping off point so you can check it out. We'll also be sharing the link to this original article as well. So I personally love this framework because the authors situate individuals and person-centered contraceptive care into some nested ecological layers. So recognizing that things in and out of the exam room or in and out of that telehealth appointment can affect contraceptive decision-making. So there is the central individual and person-centered care, and then right around that system is family and community systems, then policy and health systems, and then all of that sits within historical, social, political, and economic context. So I'm going to hand it over to Chantel so she can kind of talk through how some of these things appear in each of those layers.
Thank you very much. So we're going to start off with family and community. And for the most part, the people here today have been working throughout this entire pandemic with little to no assistance or resources for you. So I do want to ask a question for you guys to be in the chat. With everyone here today, how many have children? I'll give like 5 seconds. I love that everybody's so responsive. I love this. Thank you so much. Because it's very weird to engage online, right? And then my second part, can you put in the chat how you overcame working in childcare? Because a lot of people did not have family members in order to help watch their children, or even, oh, I got plants too, or even have friends that could watch their children, or you had to use like grandparents, and then you were concerned because your children were still going out and things like that. So if you can put in the chat how you overcame working in childcare. I keep the kids alive too. Plants are very hard, but I just started it during the pandemic. Grandparents, okay. Thank you all very much. According to those in the community that I've spoken to personally, mental health was their hardest thing because they didn't have anyone to speak to. They didn't have anybody to confide in. And then they're only with their children all day. And as much as we love our children, we need adult time. And adult time is real. And when you don't have that, it's not that good. But people had to face what they were dealing with on a whole new level, because back before the pandemic, people were able to, have distractions. During this pandemic, you had to really sit with yourself. You had to deal with yourself. And that was beautiful in one aspect, but also scary in another. And then you had those interpersonal relationships that were violent, and you had people that you're in a home with and you couldn't leave. So now you're scared and you don't know who to talk to. You don't know what to do with that either. So it's like, how do you turn? And then you have telehealth, but then you don't have any privacy. You have a room, but now you have everybody here too, and you're trying not to say certain things. So it's very hard, and it was very complicated for people to navigate that. I feel like we're trying to come out stronger with it, but it's still hard. And we need to make sure that we have providers and organizations that understand what we've been going through in order to move forward in a more productive and healthier way. Should we move on to the policy and health, maybe? So the policy and health system. So a lot of people knew that there, and my phone's ringing, I'm sorry, y'all, knew that there were racism and discrimination within these systems, right? But it was more highlighted throughout this pandemic. So I look at this pandemic as eye-opening, is scary all at the same time, but it was, you got people to start thinking and being more empathetic to those that have been dealing with things for a long time that nobody was actually seeing. There was also the elderly that couldn't come out of their homes, but they didn't have any real resources because they don't use social media. So how do we help them? So there's a lot of different things that we had to deal with. And then with the rates of STIs in the elder population rising, that was even more scarier too, right? It was just a lot of different things that nobody was really looking at, and this pandemic got us to look at it. So I'm grateful in a sense, terrified in another that this pandemic happened, but I'm happy that we're able to have these conversations today. And we were able to see what community really looked like and what organizations were really out there for the people. And we started to see them all come together. For example, out here in Worcester, they created community fridges. For those that were terrified to go to a grocery store, they created 3 fridges in different parts of the city so that people can go pick up whatever they wanted, no judgment, no anything. You just go and get what you need. I feel like that was amazing. And it showed that it does take a village, and this village came together. I feel like all of us have been doing that in our own way. And if we can multiply that by 10 more, we'll be in a better place. So historically, we want to talk now across the board. Health systems tend to negatively impact people by race, SES, and social vulnerability. All of these things are not new. The 1918 and 2009 influenza pandemics also showed racial and SES disparities, because many of the same things are true. Essential workers, lack of paid leave or ability to work from home, public transportation, inability to social distance.
There's also the concept of communication inequality, which is the unequal exposure to or ability to process and respond to new information. So in this case, we're talking about public health messaging. This can be due to so many different things, right? It can be language, literacy, method of information delivery. Are people getting their information from Facebook or from medical professionals? Where do they get their news? Do they understand how vaccines work or the efficacy of masking? And this definitely intersects with other issues and other forms of oppression. And when we talk about all of this context, we can talk about things like, how does racism impact healthcare? How does sexism impact healthcare? And a really big thing that we saw during this pandemic, right, is how does ableism intersect with healthcare and people's ability to access it?
Or forced sterilization and challenges accessing desired sterilization.
And I'll hit on this very briefly because Loretta Ross just talked about it so beautifully during the keynote today, is the idea of stratified reproduction, which is just that phenomenon of suppressing the fertility of certain groups and encouraging the fertility of other groups. So we know that that's something that occurs in the US. And we know that that's something like a pandemic is only going to exacerbate, and it will not alleviate. So that's something that we think of as we are looking at impacts from this pandemic. One more interactive piece before we get into questions, friends. So appreciate you for sticking around. In the chat, we would love if you would share any lessons that you learned from providing care during this pandemic that you want to carry into your practice long term. So what is one thing, one little pearl or nugget of wisdom or tip or trick that you've learned that you want to take with you, no matter what happens next? It's changed the way you deliver care. So please just drop that into the chat as it works. And one of the things that we really, as we reviewed, we wanted to reaffirm how important this care is to people and our communities, right? There was a lot of conversation at the beginning of the pandemic about what is essential care. And we know that access to contraception, abortion, and pregnancy and birthing care is always essential. And particularly the value of postpartum family planning when folks are having fewer in-person contacts with their healthcare providers. The opportunity to have those conversations is especially important.
An opportunity to reshape like delivery, OTCP pills, easier DMPH, postpartum LARC, evidence-based length of effectiveness. Or how can providers make a sustained change in a frame shift so this awareness does not diminish over time? Examples, trauma-informed care training, very good. Unconscious bias training, even better. I work with the Community Health Improvement Plan. I was going to say CHIP, like you guys knew the acronym, I'm sorry. And where we've created a trauma-informed racism training for our folks out here. And we're doing that twice a year right now. So if anybody wants to ever do that, let me know. Then telehealth also showed how much people don't have privacy within their own homes, like we were stated earlier. Worry about loss of choice about telehealth, which is a value to some people and some it is not so much. So now we are in the question phase. So we'll send it to Natasha.
Thank you both. That was really thought-provoking, and I loved the engagement from everyone. So as people start typing in, I do want to say that Christina has put a wealth of resources that you both collected into the chat. There's also a document with all the links in the shared drive that you put together. So thank you for that. People are still typing about telemedicine, abortion innovation, access to new methods. From your perspectives, are there innovations that you saw happen that you would love to see continue? You know, we heard from the providers in the chat, but what do you all think, or have you been discussing with the CAB or your communities?
The big one for me, and this it kind of hits to Chantel's last piece, right, of like telehealth works for some people and really doesn't work for other people, is the choice. having, as you know, as we talk about shared decision making and person-centered care, right, of like having that autonomy and choice of, you know, I want to stay home and have a telehealth appointment, or you know what, I don't, I really want to see someone in person, and kind of working with patients and providers to really, you know, figure out what works for them.
I agree with you 100%. I really want people to be more empathetic, and I want our providers to, you don't have to know the full culture. I just want people to respect the different cultures. And I feel like that's the main thing that we need moving forward, is just the respect factor. You don't have to know everything about somebody in order to respect who they are when they walk through your doors. Because if you're judging them, that means you should not be in that field anyway.
I really appreciate that. I'll just take another moment to see if anyone wants to type any more questions in before we move on. I know there was a lot of participation. Well, great. Thank you both so much. As we said, these slides and the resources are available. We so appreciate you both presenting today, representing the CAB, and sharing your thoughts on COVID-19 and contraceptive care. So thank you so much.